Good morning, everyone. Welcome to Reykjavik and Iceland for this very important press briefing and the launch of the Pan-European Commission on Climate and Health. We are joined today by an esteemed panel who will tell you all about the work of this new commission and why it's so important. Allow me to introduce them. To your right is Dr. Hans Kluge, WHO Regional Director for Europe. He has convened this commission. Next to him, Her Excellency Katrín Jakobsdóttir is chair of the Pan-European Commission on Climate and Health and a former Prime Minister of Iceland. And finally, we have world-renowned climate health expert Sir Andrew Haines from the London School of Hygiene and Tropical Medicine. He is the Chief Scientific Advisor to the Commission. So the press briefing will begin with opening remarks by Dr. Kluge, followed by a statement from the chair. Thereafter, I will open the floor for questions. So without further delay, Dr. Kluge, sir, you have the floor.
Thank you, Manu. Good morning, everyone. We are gathered in Iceland to embark on a critical and timely mission to put forward workable health sector solutions to address the climate crisis, a global health emergency that is further deepening social inequities. Climate change is already making us sick. It's killing us, and it's only getting worse. That's why we are launching the Pan-European Commission on Climate and Health, because the climate crisis is a health crisis, and climate action is health action. Let's look at the evidence. 2024 was the hottest year in recorded history. The average global temperature has now remained 1.5 degrees Celsius above pre-industrial levels for 12 consecutive months. Here in Iceland, every single glacier is retreating. Unsurprising, as the European region is the fastest warming in the world. Over 100,000 people died from heat-related causes in 2022 and 2023. And new risks are appearing. Warmer environments are supporting the emergence of mosquito and tick-borne diseases in countries that have never previously recorded them. Diseases such as dengue, malaria, West Nile fever and tick-borne encephalitis in Central and Northern European countries. We are already seeing the mounting costs of lives lost, homes destroyed, and futures erased. And the most vulnerable, children, the elderly, those already struggling, always suffer the most. Devastating floods in Spain, wildfires in Greece, landslides in Central Asia, and other extreme weather events across the region have traumatized many communities, emergency teams, and health workers. For the health workforce, summer now brings not just warmer weather, but rising anxiety and stress, with the prospect of major disruptions to health services and equipment, increased patient discomfort, and the likelihood of health workers pulling double shifts due to surges in cases of hyperthermia, heat stress, and respiratory issues. Indeed, air pollution, made worse by burning fossil fuels, now causes over 500,000 premature deaths a year in the European region. Globally, it's 7 million. Floods are the costliest type of natural disasters in the European Union, and climate change is only making them more frequent and intense, to the point of becoming uninsurable in some cases. Floods cost the European Union on average 12 billion euros in damages each year. In the WHO European region, covering 53 countries across Europe and Central Asia, 1/10 of the urban population now live in flood risk zones, and that's rising fast. 8 out of every 10 people in the region will live in urban areas by 2030, making our towns and cities the front lines against climate change. All of this means the time for talk is over. We need to come to the action. Our health systems are already under pressure, but they're also part both of the challenge and the solution, responsible for 5% of global carbon emissions, more than all the world's commercial airlines combined. This commission is our chance to flip the script, to turn evidence into influence, and ambition into accountability. The Commission's work will build on discussions at last year's COP29 in Baku, where climate and health gained renewed focus. We do have the science. Now we need the solutions that can persuade ministers of health and finance, mayors, and heads of government that investing in climate adaptation and mitigation is not a cost. It's a return for health, for peace, for prosperity. And the return is real. For example, decarbonizing the healthcare sector does not just reduce greenhouse gas emissions, it also reduces healthcare costs. Take the National Health Service in England, which estimates that switching its entire vehicle fleet to electric would save over 70 million euros every year, while delivering a range of health benefits valued at over 320 million euros. Over the next 25 years, Belgium aims to reduce health sector emissions by up to 73% through 16 proven interventions. This will help improve quality of care, eliminate inefficient practices, and improve preventative health programming, just to name a few. This is what smart policy looks like. My hope for this Commission is bold yet simple, that it becomes a true engine of practical solutions, producing concrete action recommendations within the budget space that health leadership and authorities can take forward, together with WHO, its partners, and most important, the people. I sincerely thank you, Excellency Katrín Jakobsdóttir, the former Prime Minister of Iceland, for agreeing to chair this Commission. I'm indebted to you as I am to the Commission's Chief Scientist, Sir Andrew Haines. Thank you, Andy. And of course to all the 11 Commissioners for your expertise and commitment. They, you, like me, are concerned that the window for meaningful action is closing very fast. But we also strongly believe that we can still make a difference. Ultimately, we must act like our lives and the lives of future generations depend on it, because they do. Thank you.
Thank you so much, Dr. Kluge, for your opening remarks. Now to the chair, Ms. Jakobsdóttir, you have the floor.
Thank you, Banu. And let me first say how happy I am to be welcoming these distinguished commissioners and Dr. Kluge and his team from WHO in Iceland. This is truly a very important project that we are embarking on, the Pan-European Commission on Climate and Health, because for too long we have treated climate change like a problem for future generations to solve or for distant communities to endure. But the future has truly come knocking on our doors, demanding that we act. Now, of course, the world is dealing with a lot of extreme challenges. We are seeing conflicts around the globe that have reached levels unseen since the Second World War. In 2024, the number of people forced to flee conflict, human rights violations, and persecution surpassed 120 million for the first time in recorded history. So as we grapple with this situation, conflicts and displacements, the impacts of the climate crisis have become more visible and urgent, including floods, wildfires, droughts, and extreme weather events causing untold suffering and economic damages. As these threats become more immediate, so too does another insidious danger, which is the rise of anti-science and anti-evidence narratives, which is fueled by misinformation, ideological polarization, and digital disinformation campaigns, often amplified by artificial intelligence. And these narratives are undermining public trust in climate science and health authorities. I cannot stress that enough, that we cannot afford to let evidence become a casualty of conspiracy. We must defend science loudly, clearly, and relentlessly because our survival depends on it. And what the evidence shows us is very clear. Dr. Kluge has already talked about that, and Sir Andrew is going to explain it more clearly later. But in very short, all areas of health are affected by climate change. The climate crisis is a health crisis. And failing to address these health impacts systematically will leave our communities vulnerable and our health systems overstretched in an increasingly unpredictable world. So this Commission has a very clear goal to accelerate decisive climate action that protects and promotes health. And by spring 2026, we aim to deliver actionable, practical, and measurable recommendations for policymakers across the region and hopefully around the globe. And this won't just be another report, but a concrete toolkit to help leaders and policymakers strengthen health policy, leadership, investment, and action for climate mitigation, resilience, and health protection. Over the next year, the Commission, which is made up of 11 commissioners and our Chief Scientific Advisor, Sir Andy Haines, we will consult widely with scientists, public health agencies, civil society organizations, youth, and policymakers. We will assess the interconnected global and regional risks of climate change and what risks they pose to health, what consequences inaction can lead to, and the opportunities to enhance health through robust mitigation and adaptation. We will work to raise the profile of health in climate policy and the profile of climate in health policy. And ultimately, our hope is that our work will inform high-level decision makers across the European region, which is the fastest warming region in the world, because the health of our planet is inseparable from the health of our people, and positive climate action often goes hand in hand with positive health outcomes. So I'm very much looking forward to tackle this project and tackle this challenge, and I'm extremely honored to be working with all those great commissioners that are here today, people with vast experience, which are going to join forces to really promote positive climate and health action. Thank you.
Thank you so much, Chair. So now let's move to questions from the press. We have journalists in the room and online. And if you have a question, please raise your hand in the system and we will come to you. But while we wait for some of those questions, I'd actually like to kick us off by bringing in the Chief Scientific Advisor, Sir Andy Haines. Sir Andy, could you perhaps describe the growing body of evidence we're starting to see linking the climate crisis to health, and also elaborate on how the risks might vary across the sort of vast WHO European region?
Well, thank you very much. How many hours have you got? But I'll try to summarize it very, very briefly. Thank you so much for asking me. It really is a great honor for me to be the Chief Scientific Advisor of this really important commission. So as we've already heard, climate change affects human health through a very wide range of pathways. The obvious direct effects, extreme heat, for example, increasing the death rates amongst elderly people in particular. But also it's important to understand that extreme heat has other effects as well, including on pregnancy outcomes. When the temperature rises above a certain optimum, which varies throughout the WHO region, there's an increased risk of adverse pregnancy outcomes, premature labour, for example, or stillbirths. So climate change can have an effect on future generations and on the young right now. But there are also many, many indirect effects as well. As the temperature heats up, we are seeing increasing wildfires in some parts of the region, around the Mediterranean, for example. And we know that wildfire smoke has very pervasive effects on human health, increasing the death rates from cardiovascular and respiratory diseases in the days following the wildfires, as well as probably having long-term effects as well. Climate change also affects water quality and quantity, which is a really crucial issue for public health in many parts of the region. Some parts of the regions are dependent on aquifers, which are being rapidly depleted, particularly because of changing rainfall patterns due to climate change. And of course, climate change is going to affect and is affecting food supply and safety, increasing the risk of food poisoning, for example, but probably more importantly, affecting the nutrient quality of crops. As you put more CO2 into the atmosphere, you change the nutrient quality, but you also affect the yield of crops and also the yield of livestock as well. So these will have pervasive effects on food supply, food security, food safety. And then vector-borne diseases. We've heard a bit already from Hans Kluge about those. They're very diverse. They will manifest themselves differently in different parts of the region. But we're seeing many disease vectors, mosquitoes and ticks and so on, moving as a consequence of climate change. And these will have challenges for public health, which will require much better surveillance systems than we have currently. But perhaps the most important category, but the most under-researched and most difficult to quantify, is the effect of social disruption. So migration, conflict perhaps, that's still a question that's being addressed. And these will have pervasive effects on physical and mental health. And one of the things we're recognizing increasingly is that climate change isn't just a physical health challenge, it's a mental health challenge. It affects mental health through exposure to extreme events, but also affects the health of young people today. Because we know from surveys that perhaps 50% of them are suffering from climate anxiety. And in some cases, that anxiety is severe enough to actually affect their day-to-day functioning. So it's having effects on mental health right now. But of course, the other side of the coin is that we must adapt as much as we can. We can't adapt our way completely out of the crisis, but we can do a lot to reduce the impacts. And when we mitigate, when we cut fossil fuel burning and so on, improve our diets, we can also improve health in the near term. So there is a good news story as well as a bad news story. Thank you.
Thank you for that, Sir Andy, and thank you for ending on a positive note there as well. Madam Chair, if I could come to you briefly. You are leading this important work over the coming year. Could you tell us what about this commission appeals to you and how it might differ from previous climate commissions that have come before this?
Well, I think, of course, climate has been a big issue in global politics for the last few years and decades, really, ever since the 1990s. But still, we have seen too many reports and not enough action. And I think what I like about the idea of this commission, when I was asked to lead it, is that its goal is such a clear goal that we want implementable action that policymakers can use. And having served as the Prime Minister of Iceland, I know it's very difficult to implement policy on climate action because climate change and the climate crisis affects every aspect of our society, every sector. So you always need to be thinking holistically. You always need to have a whole of government approach. And as a former politician, I know that can be quite complicated. And I know these people who are going to join forces with me on this commission, they share those experiences and their wisdom is going to be crucial. So we can actually create recommendations that can create deliverables that policymakers see that can work. So we will be looking for best practices. We won't only be looking at the situation and analyze that. We already have a lot of evidence. We are going to build a solid foundation, solid scientific foundation for the work that we are doing, but we will also be focusing on what can actually be done. And I'm optimistic that we will deliver very concrete recommendations in May 26.
Thank you so much. Actionable and affordable seem to be the key words here. So we're coming towards the end of the press briefing, but I'd like to give the sort of final word to the regional director. So Dr. Kluge, would you like to say some final words?
Thank you, Banu. Yes, enjoying the optimism of our chair, which I subscribe, because this is very important. There's so many things happening in the world today. But I wanted to point out that this is a pan-European commission, though we have invited observers from all other 5 WHO regions and WHO Geneva. So, in essence, what will come out of the Commission will also be disseminated globally. And one of the commissioners who is physically not here because she has an exam, but is very important, is Dr. Omnia El Omrani, because she was the first youth envoy for the Egyptian Minister of Foreign Affairs and for the 2022 UN Climate Change Conference President. So very important we have the youth with us, because there are so many things that also depend on us. I know it myself because I'm educated on climate change every day, my 2 daughters, and reminded what we can do ourselves, be it, for example, on walking, cycling, because we know that transport is the 3rd biggest contributor to emissions. Same for heat and electricity. So to have the youth on board is very, very key. Thank you.
Thank you so much to all the panelists. So on this note, let me close the press briefing for today. Thank you, Regional Director, Chair, Scientific Advisor. We truly wish the Commission and all the Commissioners great success over the coming year. Thank you to everyone who joined the press briefing online. If you need additional follow-up, please do drop us an email that was included in the invitation. And on that, thank you very much. Have a wonderful day. Bye-bye.